So I am here with cardiac surgeon Rachel Harrison, and she's making us a drink because we're gonna have a conversation, but we need to have a drink to have a conversation. So Rachel, what are you making?
We're gonna make my favorite, which is an Aperol spritz, and then a twist on the Aperol spritz using Saint Germain.
Awesome. And tell me about, you're a surgeon, so you probably are into tools, and tools are, what is this? What are you doing?
This is a fun tool, so I love this, and not many people, most people just try to, and don't, like, I'm not like an expert in this at all, but most people just struggle with the cork, so I brought my favorite tool.
Okay. Whoa!
It makes it so easy to open. It just
that's awesome.
So you need to get one of these.
Okay, tell me what it's what's it called?
So it's 3, 2, 1.
Okay.
The wine.
Recipe. No. The tool. What's the tool called?
Oh, the tool. I don't know. It's a champagne opener.
Okay.
It's got little teeth on the inside.
Awesome.
Fun. So the recipe.
Okay.
3, 2, 1.
3 parts prosecco.
So we'll do.
Yeah, the top does 1.5 ounces, and I think the smaller one is an ounce.
We'll do it. Just the 3, 2, 1.
Now, one of the really cool things about Rachel is that she used to play the oboe. So she kind of knows my world a little bit, and I don't know anything about her world, except that I know some doctors.
I feel like I'm getting a lot of fuzz and not a lot of.
Okay, so you're just adding a little bit more and just toss it in. Okay.
Yeah, I'm just gonna eyeball it, I think. We'll 3, 2, 1 that.
That's kind of how I'm doing with this really terrible videography, just sort of eyeballing it.
That's okay.
It's not.
Use your best judgment.
I think. Okay, Aperol. It's a good drink. So we were discussing what drink to make here, and
and it's really on.
I believe I have perfected the old fashioned, but you said you don't like old fashioned. So
I'm not a whiskey person. So
oh, okay.
I can't do the whiskey.
I feel like whiskey is a health tonic. What do you think as a cardiac surgeon? Is whiskey a health tonic? Is there any beverage that's a health tonic?
I don't know.
What should I drink to stay out of your operating theater?
Water.
Okay.
How about that?
Okay.
That's the right answer, right? I think they say red wine, but I don't think there's any data to support that.
Okay.
Oh, you know what? I was gonna make the Saint Germain.
Oh well, we'll start with this, and we can
start
always
with this
redo
and
it
we'll make
if
the
we
Saint
need another
Germain
one.
as the second one.
Yeah. Then the interview will really get going by that point. Okay.
That's fine.
Okay, and a splash of sparkling water.
And that's it.
Beautiful. Should we garnish it with something?
Usually orange, but it's fine. We don't.
I have some tangerines.
Yeah.
Okay.
Garnish with the tangerine.
Okay, hang on. Cheers. Okay, I think we're on camera. The dogs are right there. So Rachel, you are a cardiac surgeon.
Yes.
How long have you been doing that?
I've been in practice since 2016.
Okay.
So you do the math.
And what is the training like to become a cardiac surgeon?
So you got high school, college, 4 years, med school 4 years, and then you have several different tracks you can take. The standard track is 5 years general surgery, and then 2 to 3 years cardiothoracic, and you board certify in both cardiac and thoracic, so heart and lungs.
So you did 8 years post-medical school training?
Correct. I didn't. So that's the standard track.
Mm-hmm.
I knew I wanted to be a heart surgeon since I was little. Since I was in college, high school.
How do you know you want to be a cardiac
Well,
surgeon?
my mom was a CRNA, or she's a CRNA now. But
okay, tell them what a CRNA is.
Oh, sorry. Let me back up. So when I was growing up, my mom was an RN, a nurse, and she worked in the burn ICU for when I was really little, and then she was in the CVICU, which is the cardiac surgery unit, for many years as I was growing up. And so I was exposed to that. I would go and play my violin for the patients, and she would always bring me in, and so I was like exposed to that for a long time, and she was like, you're going to be a doctor. You have to be a doctor. And when I was in college, she connected me with one of the surgeons she worked with, and I went and shadowed him and worked with him for the summer, and I was hooked.
And you were sold.
I was sold.
What did you love about it? What did
it was just real. Cardiac surgery is like one of the coolest things you'll ever see.
I will probably never see it.
It's mind-blowing. So like when I have students come shadow me in the OR, they're just like, if they have their mind in the right place, of course, but like they are just like jaw drop. Like it's amazing to see.
My mother told me, she's a doctor, she told me the first time she saw that, she passed out.
Yeah, so you have to be in the right mindset.
Yeah.
You can't be like sensitive to blood or anything. But if you're like really interested in like, you know, physics and physiology and how things work, the heart pumping is like one of the most amazing things you'll ever see. And so to see it stopped and like us actually working on it and then it starts again, it's like a miracle. It's just amazing what we do. And so that kind of blew me away and I was really hooked.
You're like, I'm going to spend the next 8 or however many years figuring out how to do this. So the hospital where you work, you are the only woman cardiac surgeon.
Yeah.
Out of how many cardiac surgeons?
In the practice?
Yeah.
3.
Okay, so there are 3. Are there any other women in Baltimore that are doing cardiac surgery?
Yes, there is one at Hopkins.
Okay, so 1 out of all the cardiac surgeons in Baltimore. So 2 total.
Mm-hmm.
And how many, I don't know, how many cardiac surgeons
Probably
in
like
Baltimore?
maybe 4 or 5 programs.
So is that 30 people?
Yeah, maybe.
Okay, so it's like 2 out of 30.
Yeah, those numbers sound about right.
Okay, that's kind of like playing the tuba or something. That's probably like the number of women playing tuba.
the oboe.
No, I mean, we have more women than that for sure. I mean, they're probably at least 50% of oboe players, I think. Are women.
Oh, I was thinking like percentages.
But in orchestras,
the symphony.
as the places pay more, we see fewer and fewer women.
Yeah.
But I'm thinking like the number of tuba positions there are in the United States. Like there are few women who play tuba.
Yeah.
You know, maybe in the top 30 orchestras, there are probably 2 or 3 women, something like that. So what is it like being, I mean, you haven't had any other experience, but do you feel like it's an easy thing to do to be a woman cardiac surgeon? Do you think you don't think so?
I don't.
Like, are there a lot of biases against you? What do the patients think when they come in and they see you?
I don't get as much my nurses in the room. I got to get off the phone. I get that about once a week. I think, you know, they're on the phone and they'll be like, oh, my nurse just walked in. I got to go.
What do you say?
I don't get that very often because I try to wear my white coat and like demonstrate like sort of like a physician figure. But I do still get it maybe like once a week. So, I mean,
So what do you do? You're getting it once a week. What do you say?
I think there are more female physicians who get that more than I do because I see it on like the social media. I don't say anything. You
just say, hi, I'm Dr. Harrison.
Yes, and I let it speak for itself. Okay. I think being a female physician in this field is so freaking hard. It is still hard to this day. I mean, like, I don't want to speak about current experiences, but like there are still biases that happen on a daily, minute by minute basis.
So where did you go to college?
I went to Vanderbilt.
Oh, wow.
I went to Vanderbilt. Nice. So I'm a band geek, so I was in the marching band. And
okay, so you played the oboe too. You got to tell my audience.
Yes, I played oboe. I played oboe.
So you played the violin mostly?
Violin was like my primary instrument. I played that since I started with piano at age 5, and then I added violin at 8, and then it was really hard doing both at that age. And so when I was in 5th grade, that would have been 3 years later, I didn't want to do piano anymore. My mom was so tough on me. She made me call my piano teacher and tell her that I didn't want to take piano anymore. And that was really traumatic as a 5th grader.
Oh, that's what I threaten my kids with all the time.
Yeah.
Like, oh, you're not
you
want to quit, then you need to call your teacher.
You call your teacher and tell. So I did that, and then I just did only violin.
And then you decided to play the oboe somewhere.
Yeah, so then band came up, and of course you can't play oboe right away. You have to play flute or saxophone or something. So I started with flute, and because the fingerings are similar. And then the very next year I got an oboe. And
okay, so that's like 6th grade?
That was like, so I started flute in 6th grade, and then in 7th grade I started oboe.
Have you ever played English horn or something like that?
I did the I played English horn for one piece that we had required.
Have you ever played a bass oboe?
No.
Do you want to play the bass oboe tonight?
No.
You don't want to play the bass oboe tonight? What if you have 2 drinks? Would you play the bass oboe?
I would honk on it.
Yeah, that'd be pretty cool. It's twice as big as an oboe.
It's been so long.
Oh, okay.
Because I play my violin's my main thing. We didn't have an orchestra in my school because I went to a public school, and so I lived in Arkansas. We didn't have an orchestra. so we would drive across the river to Memphis, and I would take violin lessons. So it was very odd. I was a very odd kid growing up. Like, I wasn't the average small town Arkansas kid. How I can say that in a way that's politically correct. It was a well-established practice, and I came in as a newbie, and I wasn't part of like the boys club. So it was hard to like establish myself unless I did all the high risk stuff. I never said no. I never passed judgment on a case. I just did it. I just did the cases that came to me because they were cases, instead of like saying, actually, no, I don't think this is a good idea, and like being a dissenting opinion. I could never be a dissenting opinion. I always had to be the yes man. Otherwise, I couldn't be successful.
And what was your medical school class like? I know you said that there are maybe 2 out of 30 cardiac surgeons in Baltimore.
Yeah.
Women, but in
it was
your medical
probably
school,
50-50.
Yeah.
It was probably 50-50.
Wow. So what is it about this field that there's such a drop off of women?
I think it's time and perception.
When you say time, is that the training time or the time on the job?
Both. I mean, I think it's training time, time in the OR, time away from your family. Like, these surgeries are long. The surgeries can be, especially the ones in training where you're doing like a double lung transplant, those can be like 12-hour surgeries. That's not, if you're nursing, if you have a kid and you're trying to go pump breast milk in between, you can't do that.
Yeah.
You can't do that for over 12-hour period. So it has a perception of being not amenable to women. That being said, when I graduated, so there were 2 fellows per class for a 3-year period. So there's 6 fellows. My chief year, my last year, it was 4 females and 2 men.
Oh. Wow.
So, I mean, with the paradigm, the whole thought process of women who can or can't do this is like sort of changing.
It's changing. And
Yeah.
but you think that it's the childbearing thing that may have something to do with
Yeah,
this,
absolutely.
this fall off.
Yeah.
Wow.
I think women who don't intend on having children don't. I have a couple of friends who have no intention of having kids, and they've never seemed to have been hindered by the work hours.
Yeah, I mean, see, I don't even want to ask you this question in an interview. Like, this is something I'm always asked in interviews. Like, how do you manage your family life and children and all this? And like, that's not, I think, super relevant to your work, right? Your work is that you've done this huge amount of training. You've become an exceptional surgeon, and here you are, one of 2 women in Baltimore doing this job. So like, I don't. And if you want to talk about it, it's fine. I don't want to ask you about it, but I guess maybe this is part of the fall off.
Yeah, no, I mean, that is the question that
and that they can't manage to have children.
That is the question that everybody wants to hear, right? Everybody wants to hear the answer about it. And I think the way that I survived, and I actually had an attending in my when I was a chief, I had an attending come talk to me and say, can you tell these girls how to do this? Because you did this.
Like how to have babies?
Yeah, no, how to have a child. Because I had an infant my chief year. And I was nursing and breast pumping and doing all the things my chief year, my last year. And I guess I was doing a good job of it because one of the attendings came up to me and asked me, like, can you counsel these younger people how to do it, because they're complaining and I'm hearing about it, and can you talk to them? I guess because I think it's because I'd never complained.
Yeah.
I was never verbal about, okay guys, I gotta go pump now, I gotta go, sorry, I gotta go. You hide that shit.
Yeah.
So
my mother, who's a doctor, tells this story that, when I was an infant 46 years ago, she was pumping in the bathroom, like with a hand pump in the bathroom stall.
Yeah.
Which hopefully it's a little bit better than that now.
I mean, I had a call room and I would like just pump and like do my notes and work at the same time, but like I just didn't talk about it. And I think there's like, unfortunately, there is this level that you just don't cross, and you just have to.
Right, we always have to shut up about
you just
things.
Just like don't.
But if the men had to do it, they would definitely be talking about it.
Oh yeah,
right?
Yeah. There's always going to be a double standard. Don't try to change that. I don't know.
Do you ever feel lucky to be in the room? This is how I felt for like the vast majority of my early career, was like, oh, I should just not say anything about this or that totally inappropriate thing because I'm lucky to be here, right? There are relatively few of us, and you know, I made it to this position, so I'm just gonna smile. And
I don't feel lucky. I worked harder than every male colleague next to me, and I worked harder not only academically but socially to get
referrals or
no to be where I am without having to, like, if for example, if you speak out in any way, if you're abrupt in the operating room or on rounds, you can say the exact same thing that your male colleague says with the exact same tone of voice, and you're in the program director's office,
right,
in trouble.
Sure.
And this guy over here is
nice guy.
Successful. He's great. Oh, look what a great surgeon he is. He's so authoritative and charming, and meanwhile, this horrible resident is causing problems.
Right.
So I feel like having overcome that and learning how to like not land in the program director's office all the time.
So what did you have to do to do that?
Oh, you have to be nurturing. You have to fake it, sort of. Unfortunately, you have to hide your personality a little bit. And I hate that. It sucks. But this is what's been successful for me. And I'm not claiming to be successful at all with this, because I'm very verbal, and I have to like check my
well,
tone.
I mean, look, if you have someone's life in your hands, right? Like, you're in charge. You have to be authoritative. I would want my cardiac surgeon to be
I think
authoritative. Right?
You know, I will sometimes let it slip, and I'll be like, yell at somebody. I try to make an effort afterwards to go back and say, hey, sorry, things were short. You know, we were in a really sticky spot. You did a great job today. Thank you for your help. That 5-minute conversation is what I feel like I've tried to get better and do, so that I don't get in trouble.
Wow, that's.
But it's kind of pathetic that you have to do that.
Yeah, no, I don't doubt it at all. But it's funny because Mr. Needleman's always telling me that my working environment is we're very like fragile, and we can't tell people what we think. Right? He's always he's like, well, why don't you just tell them that they're sharp or flat or late or whatever? And I'm like, oh no, you can't do that. You have to say, oh, could we go over this passage together? We're not quite in tune, you know, and you have to smooth all the edges. And he's like, well, in the operating room, you just yell at them and say, and there's cursing and there's all of this stuff, but maybe that's not from the women. Maybe he's just talking about the men.
I try not to drop the F-bomb ever.
So you mentioned this mentor who you met when you were a kid, and then he got you hooked on it when you were in college, and then you did the full circle thing, and you came back and you worked for him after you finished your training. Yeah. Did you have any women mentors in this field?
I did. I had one. Actually, I had a couple. So I had a couple of general surgery mentors who, very different personality, different practice style, different environment totally, but still like same in terms of male dominated field, trying to be successful. And then I had she is a pediatric cardiac surgeon. So she does baby hearts.
Oh wow.
And they're all amazing.
So why do you think your mom said to you, Rachel, you gotta be a doctor when you're a kid?
I think she saw how successful they were and how much authority they had, and I think she wanted that for me. I will say being on the East Coast is a totally different experience than being in the South. So when I practiced in the South, that was my first ever experience as an attending,
physician.
Finally, these are my cases, these are my patients. That experience, I was a junior I was brand new, so that has its own issues. So I'm more experienced now. I'm mid-career. But also being in the South is really difficult.
So you think it's easier here?
I think it's easier. I think it's easier on the East Coast. I think women can.
So what experiences did you have in the South that maybe you don't have as frequently?
It's a boys' club.
And you don't feel like it's such a boys' club here?
I don't. I think my opinion is respected. I think people value what I have to say, and when I have an opinion, they listen to it, which I didn't always get that before. And I don't feel like my management practice has changed a whole lot. So it's not like all of a sudden all of a sudden I'm saying things that I wasn't saying before. I think it's the environment. I think I'm more respected, but also the culture in which I practice. I'm also more raised up by my colleagues. So like my fellow co-surgeons are also very supportive of me.
Oh, that's good.
Whereas I don't know if I had that at the previous practice. So having like the male supportive saying like, oh, Rachel's a very good surgeon, I trust what she has to say, and then I come around and give my opinion and they say, well, they said that I could trust her, so do you know what I'm saying?
I mean, I guess that's good, but it's not
also
that
doesn't
good.
stand on its own.
Yeah, that doesn't feel so wonderful anyway.
Like you're dependent on your colleagues to support you.
Yeah, that's a little unfortunate. So how do you get patients? Because I'm just an old player. I don't know, and I try to stay away. Right? I don't want cardiac surgery. But say I'm having chest pain or something, and I go to the ER. How do I get from being in the ER to seeing you?
Through a cardiologist.
Okay.
So the cardiologists are like the front line, and we are the end. Like we have tried everything non-invasive, medical, stents, or transcatheter valve therapies. And none of this is going to work for you, and now we need surgery. So we're sort of like at the end. So to try to get referrals and patients, it's not an easy thing to do.
Because people are so freaked out at this point.
And so basically my whole philosophy for practicing is I just do the cases as they come, and I'm not saying this is the right way, but I just try to do the very best job that I can and like be perfect every time. And slowly, people will know that she does a perfect job every time, or she tries her best to do the best surgery for the patient that's going to give them the longest outcome. And so when they do come through, they say they'll in the future, maybe, hopefully, they'll say, well, if you can try to get with Dr. Harrison, because we know that she really cares, she has a good bedside manner, she takes care of her patients, and she's technically very good.
Right, but the patients themselves don't know, right? Because they're knocked out and their chests are open.
They're dependent on they're dependent on their doctors to know where to go.
So these are the cardiologists that they see in ERs, or that they've been referred to by their primary care physicians, or something like that.
So it's kind of like, I feel like it's word of mouth, sort of. That you can't like put up a billboard, So my favorite operation is bypass.
Okay.
Bypass. It's very bread and butter. It's very basic. It's not fancy at all. It's not like I did heart transplant for a while. That's very like showy, like, oh, look at me. But I like the coronary bypass surgeries. So when you can't get a stent, when you've had a heart attack, and you can't get a stent, which is ideally the best option, but you have so many blockages that
Why is it ideally the best option? Just
because it's no
basic.
surgery.
Okay.
Because there's no surgery.
Sure.
But there's a handful of patients that it's not suitable. It's not a suitable therapy. So we have to bypass. And the reason why we're in there is because we're going to hit multiple parts of the heart. We're going to restore the blood flow. I like it because it's regular, it's predictable. The surgery is it's not the same every time, but it's the same routine. It's microvascular, so I love like the little stitches, the fine detail work. I feel like that's more my thing than like the big. When I say big, like the bigger needles. I like the fine work, and I like the results. So
I've been told you have good hands from my spies.
Oh.
Very good hands. But it's funny because if you're a patient, you don't know that your doctor has good hands, right? You don't have that.
You don't. It's
so like, how do you know? How do you pick a cardiac surgeon? You don't, right?
Yeah,
you just get referred.
You just get lucky.
You just get lucky or not lucky, right?
Gosh, yeah. I mean, I personally had an experience.
I mean, bedside manner is not going to matter in this, right? You shouldn't care about the bedside manner of your cardiac surgeon. You want them to have good hands.
I think the referring cardiologists know.
But they're not in the room, right? I guess they know the outcomes.
They know the outcomes. They know who comes back to the ER. They know, like I'm so self-conscious about readmits and patients coming back, and when they come back to clinic, how are they feeling? And I document their flows on their graphs, so I know exactly the result in the operating room, and then I can, when I see them in clinic, I'll go back to my operative note and I'll look at the flows and be like, okay, was this a good one or was this a so-so one? And sometimes it's out of my hands if the flows weren't great. Sometimes they have really bad disease and I do the best I can. But it's nice to see the patients come back and they feel great, or my partner knows that I like it, and so I think he sort of helps me out by making sure that I'm the one doing those cases. Of course, he does those too, or both my partners do the same cases I do. It's very basic. I mean, every surgeon coming out of training knows how to do this one operation. I do the other ones too, the valves and the aortas and the other stuff too, but in terms of like my favorite, if you could ask me if you could do one thing every day, what would you do? That's
and are you doing that pretty much every day?
Much, yeah.
Because everybody,
I'm living the dream. I'm
awesome.
Like, so happy.
Oh, that's so good. Wow. Do you think there's any connection? You said you were making oboe reeds at some point, right? This like fine work. Does that help you as a surgeon?
Yeah, totally. I mean, I did piano. Oboe playing is very, hand motion, finger motion, very fine. Violin is the same.
Yeah, so it's good for kids to study, even if they don't want
Absolutely.
to do it. Right?
It's a universal language, I don't think that I'm that young anymore. And
Can I ask how old you are? Am I allowed to ask that?
I'm 41.
Okay.
I feel like I've been doing this for a while, and I know what I'm doing. And when someone comes along and acts like they know more than me, it's very insulting, especially when they're not a doctor. And I get that.
How does that come off?
I get that.
How does that come off? Like, what is this?
It's very like passive aggressive, and I can't give an exact example, but just like undermining my own authority.
I mean, is that something that still happens?
It does.
Yeah.
It does. And I think it's because I'm female. I think if I was a male, I would never...
A 41-year-old man, you wouldn't have this.
A 41-year-old man would be like living the dream. And I am living the dream, but I do still get like hints of questioning my authority from male professionals.
Do you ever get it from patients? I know you said that sometimes.
No, never.
Oh, the patients are...
No, I never.
Good.
The patients are very... And I'm not sure how that happens, but
that's great. That's good to know.
Yeah.
I mean, you probably see like all walks of life, right?
Yeah.
Because it's not really predictable who's going to need heart surgery, is it? Or
what
can we do to avoid heart surgery?
I think the most important thing is to see your primary care doctor and know your numbers. So know your cholesterol, know your blood pressure, and your heart rate, like know your body and take care of it. My cholesterol was over 200 a couple years ago, and I lost 30 pounds because I was like, this is a setup. This is not good.
My own office.
Yeah. So like knowing your body and knowing how to change your diet. It's all about diet. I feel like I'm not a dietitian, so what
should we eat and what should we not eat?
I don't know. I'm not a dietitian. I think eating around the periphery of the grocery store, the fresh foods, the colorful foods, staying away from the processed.
Aperol is colorful, right?
It's basically a fruit salad.
Yeah.
Eating the fresh foods, I think, is most important, and trying to stay away from like processed French fries and
French fries are good.
I know they are good.
Yeah.
But I think also everything in moderation and knowing your numbers, because if your cholesterol's high, you know you're in trouble. If your sugar's high, you know, don't eat cake every day. It's just a setup. And then smoking is like
Disaster.
the worst you could ever do. I mean, smoking is so damaging. We operate on people who smoke every day. We operate on people every day on people who smoke. It's, you can see on the inside of the body what it does.
What does it look like?
I mean,
inside?
the lungs are black. The aorta is hardening of the arteries. The aorta is crusty, crunchy.
Ew. I don't want a crunchy aorta.
And diabetics, their arteries are like all shrunk down, so they don't have good blood flow. That's why they have heart attacks. A lot of diabetics have silent heart attacks because their blood flow in the little tiny microvascular micro vessels is so bad that their nerves are sort of dead, and so they don't even feel like they're having a heart attack. So diabetics will go along and not know, and then they'll show up to us late when the disease is already too far gone.
So I was watching a video that you made about, and you were talking about women, and especially women of color, that we don't understand the symptoms of heart attacks because it's much less described.
Women, first of all, women, and I don't have the data to quote to you, but women and minorities are far less like under treated, under recognized, not listened to. I'm not quoting anything accurate at the moment. I just know it like in my mind. I know it because I've read it. I know that women are not listened to, minorities are not listened to.
Well, their whole lives, and then maybe they don't even think to go to the doctor.
Or they don't stand up for themselves when they know something is wrong, but their doctor says, well, all your tests are normal, but they know something's wrong. The other issue is you, as a woman, you might just have indigestion and you might think, oh, it's my gallbladder, or I needed to eat something different, but really you're having a heart attack.
So what are these symptoms?
Indigestion, shortness of breath, fatigue. So not like the classic like elephant on your chest. So a lot of women will have those type symptoms, and it's not recognized. The other thing is women are so tough. So you heard about the man flu. So like women will just tough it out. I feel like a lot of women will just tough it out and not go, especially with like aortic stenosis. People will feel tired, and that's the only thing they feel.
Yeah, but I feel tired every day, and I hope I don't have aortic stenosis. Yeah. How do you know?
Go see your doctor, huh?
Yeah.
I mean, they can hear a murmur. That's just a simple stethoscope on the chest.
Oh.
But a lot of people will like take naps during the day, and then, I'm just getting old. Yeah. And actually they have aortic stenosis, and then we fix their valve, and they're like, wow,
I'm not so old.
I didn't realize how bad I felt.
Wow. So for men, the classic symptoms are like elephant on the chest, right? Is it right arm pain?
Left arm pain, jaw pain, numbness. Yeah, but even a lot of men don't have diabetic. Diabetic patients are like wild cards. You know, they may not have any symptoms.
Yeah, okay. Well, you were telling us about your book because we're making another drink. But tell me about your book. You're going to write a book when you're 80, and it doesn't matter anymore.
Yeah, I'm going to write a book when I'm too old, where it doesn't matter if I get in trouble. But
and it's going to be called.
And I'm going to have like a whole bunch of stories of life experience. And the title, I think the title is going to be "You Should Smile More."
Do you ever get told that?
That's the whole point of the book, because
I'm just asking stupid questions.
How
often do you get told that?
Probably once every 3 years.
Oh.
Yeah.
Is that going down in frequency, or is that it's been consistently?
I think it's going down because I'm learning the game. I'm learning how to play the game a little bit better. Maybe we lost our measuring cups.
Oh, it's right here. The measuring cup's right there.
Okay. Yeah.
Okay, so we're doing again 3.
So now we're gonna do the,
which means just like pour it in. She just pours it in.
We're not gonna. Well, we go to the top of the ice. Let's do that.
Okay.
Because it's half of it's foam.
Okay, and this is called a
Saint Germain Spritz.
Fizz. Spritz. Okay.
I don't know the proper name. I just know the. Okay. Let's do the other side.
Oh, here, I get it. You want to get?
Mine's been open more recently
Okay.
than yours, I think.
Oh no, ours has been open recently.
Oh, okay.
Don't worry. But so now you're measuring this, but you just kind of filled it up with prosecco.
Yeah.
Are you gonna do 2 of those?
Yeah.
Oh wow. Okay.
Is that too much?
No, it's fine. So Saint Germain. How do you
Saint Germain,
I don't know.
I took Spanish.
Okay. I actually studied French, but I don't
Okay.
know how to
So
say
this
it.
is the end of it. So.
Oh wow. Okay.
Okay. Well,
Wow,
it's not the end of it. So
The
I
end of
lied.
this interview is gonna be like. Okay. But it has a very nice like floral scent.
Elderberry.
Yeah, it's not particularly sweet. It's a little bit sweet, but for me,
It's mostly
like,
water.
Oh, it's just like a health tonic.
I gave you
Okay.
more water.
Let
than
me
you.
taste it. Let me see how it is.
All right. Yeah.
Oh, it's very
It's
nice.
good.
It's
It's good.
refreshing.
It's light.
Yeah, it would be a very nice summer drink, actually. I think.
I'm gonna leave
Should
this.
we garnish it with
No.
tangerine? Okay, no. Why are we not getting this on film? Okay, we're talking about harvesting the mam. Tell us about harvesting the mam.
Oh yeah. So the whole operation, the whole important part of cabbage, coronary artery bypass grafting, bypass surgery for the heart, is doing the mammary artery. That's the best one. It lasts the longest. We get a bonus from the vein from the leg. We take vein out of the leg to do the other bypasses. It's like when you have a blockage. It's like when you're going down 83 and there's a car accident on 83. You take a side road. That side road becomes the new highway, and we just leave the car accident at 83. So that's basically what we do here when you have a blockage that can't get a stent. And so the mammary artery is like the best one. It lasts the longest.
So you have to have a really good harvesting of that in order to put it in the heart to make this bypass.
To make it usable. So taking the mammary down is almost as important. Mammary, when I say mammary, the internal thoracic artery. It's the mammary artery that feeds the mammary glands, the breast glands. You have another one that feeds, and they cross-talk, and you have intercostal arteries that feed the rest of the chest. So you won't miss it when it's gone. And then it's like God put it there for us.
For cardiac surgeons.
Yes.
Wow. And you were
Spare
saying that you love this is your passion, the regular cabbage surgery, the cardio. What does cabbage stand for?
Coronary artery bypass grafting.
Yeah. I just know it as the vegetable cabbage. The cabbage.
Yeah, that's a different one.
Yeah. But you say, oh, you're making it like it's an easy, simple surgery, but it's not. It's
very delicate.
in your hands, and you can really screw it up.
So the way we sew it onto the heart is with this fine suture. It's thinner than a human hair, and we sew it around in a circle. And then
are you using your hands for this, or are you using special tools?
We use special tools. There's a needle that's attached. The needle is about maybe 4 millimeters, or no, it's about a centimeter. The needle size, and it's attached to the string, and then we sew it, and then
So you're not threading that.
no. It comes attached, and then at the end when we sew a circle onto it, we tie it. So it's very like tying that suture is very delicate. I don't know if you remember making friendship bracelets as a kid.
Yeah.
The knots that you make for friendship bracelets are exactly the same knot.
Wow.
So when I talk to girls about cardiac surgery, I'm like, it's just friendship bracelet making. But it's actually very delicate. It's very delicate.
And so you're using tools that operate these needles.
But then you tie the string with your own hands.
Okay. So I wanted to ask you about your hands versus a man's hands, because we have all these ideas in classical music which are like so stupid, most of them, like oh, you have to be a big man to make a big sound. Like even playing the cello or something, people think oh, being a big man is helpful. People think playing the oboe, being a big man is helpful. I'm actually convinced that being a big man is probably not helpful for playing the oboe.
You're probably more agile with your fingers.
Well, the oboe is a small instrument, so I think that having huge hands is of no benefit, and most people have too much air when they play the oboe, so the bigger your lung capacity is, the kind of more you have to deal with that. So I don't know that there's actually any benefit of being a huge
I think
man.
there's a benefit of having small hands, being a cardiac surgeon, because you have to, a lot of what we do is lifting the heart and rotating it, looking at it, and being very delicate. And so having small hands helps. I've seen surgeons with large hands, and they try to be delicate, but you can't help it if you have big hands. I mean, it's easier to fit your hand in the space between the heart and the chest wall to lift it and look what you're trying to do, or rotate it, or manipulate it, just whatever you're trying to achieve.
So somebody who's like really smart and really good at this, will they get around whatever physical attributes or
I think
they have or they don't have, or are there certain things that just make you better?
I think
The small hands just make you better?
I think so, yeah. It's just it's like a bull in a china shop. You can't help it. Bull's a great animal, but the china shop's the china shop. You have to be delicate and fine and detailed and careful.
Yeah, so maybe we actually need more women cardiac surgeons, or at least more people with small hands being cardiac surgeons.
Yeah.
Do you have any advice for people that are maybe in college or high school or whatever, and they've gotten this bug that they've decided they want to be a cardiac surgeon, whatever has happened, maybe they had them take them somewhere, or they've decided they want to be the cardiac surgeon. What are you going to tell them?
Don't let anybody tell you you can't do it. Don't let anybody tell you. And don't be afraid of work-life balance. That's BS. Work-life balance is BS. I balance my work life by having my kids go to school close to where I work. So I
didn't ask this question. She's offering this.
Yeah. I break away. I can go to a kid's Christmas program and then go right back to work. That's how I've balanced it. And I think it's doable. And I wouldn't be... Here's the thing, if you find something that you love, you know that you love it when the time flies. So like, for example, I was on like a pulmonary rotation, learning about lungs and cystic fibrosis, and we were taking care of these little kids, and I was bored out of my mind, and like it was only like 3 hours of rounds, and I felt like it was forever. But then when I went to surgery, it was like boom, 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 and then I looked up and it's 11 p.m. at night, and I'm like, where'd the time go? I've been having fun. That's how you know what you love. So you have to do that. You have to do what you love, and you'll never work. You'll always be doing what you love. And so if you find something that you love, that's my advice. Don't be discouraged by all this BS around work-life balance, because if you really truly love it, you'll figure out a way to make it work. And so that's what I've done.
That makes sense.
And then the other thing is, once you do have kids, it's not about quantity, it's about quality. So even if I only have like 20 minutes at night, I'm like, my phone's up, I'm not distracted, I'm like absolutely 100% with my kids, and they appreciate that. And now, my kids know what I do, and they're very proud of it. And I don't think there's 1 ounce of their thinking that is, mom likes work more than us. Like, I think they know that I'm very much invested at home. So that's the balance for me.
Wow.
So I picked up the oboe after playing flute for 1 year.
In 7th grade.
1 year in 6th grade. And
then I thought flute was 6th grade.
Flute was 6th grade.
So 7th grade.
7th grade I picked up the oboe. And you buy the reeds that are like pre-made, and they're like horrible. And I started out with the principal oboist of the Memphis Symphony, and I took lessons from her. I can't remember her name. But ultimately I found myself driving to Jonesboro, Arkansas, which is an hour away, at Arkansas State University, which is where Dan Ross was. And I took lessons from him. He didn't charge me because he always said, if someone is this passionate about music, you shouldn't have to charge them to teach them.
Wow.
So
he taught you for free?
He taught me for free. We spent an hour every Monday, I think. And he made me reeds up front, but then he taught me how to make reeds. So
how old were you when you were making reeds?
I was in like maybe 10th, 11th, and 12th grade.
Wow.
And like wrapping them, like the whole thing.
Yeah, that's important.
I can picture like time.
Rachel was telling me at the beginning, she's like, I studied with this guy, and he like made a machine that scraped it. I'm thinking, profiling machine? I was like, was it couching machine? I was like, was it Dan Ross? She's like, yes.
Yeah. Yeah, that was him.
Wow.
So I'll find the picture of us together. So very passionate guy. Very nice man. And he tried to get me to come down and play in the Tupelo orchestra with him.
Oh, wow.
He would go down there. This is in Mississippi.
Uh-huh.
He would go down there and play, but I just couldn't make it happen with all the things happening. But that would have been fun. But
Okay, so I have like a tenured job, and your job is not tenured. Right?
no, it is not.
So what can you get fired for as a cardiac surgeon?
I think more than anything, I think being a bad team player and doing something harmful.
I mean, obviously doing something harmful to
Yeah.
the patient, but
the
nobody's
patient.
trying to harm a patient, right? Like accidentally harming a patient.
Yeah. And of course, we have our M&M conferences where we go over our mistakes and we own our mistakes. And we're human, so mistakes happen. I think it's got to be a pattern of negative behavior.
Mm-hmm.
I can't, we're all human, we all make mistakes, and sometimes we say things we shouldn't. But being regularly a jerk or being regularly having bad outcomes, something that's a pattern of negativity,
Mm-hmm.
I think sets you up. So you have to have like a track record
Yeah.
of negativity.
Do you think that there's a different standard when you say being a team player? I know you were talking about afterwards you have to sometimes have a discussion with somebody.
Yeah, if you've had a bad day, I don't think you have to have, if you've had a bad day, let's face it, cardiac surgery is high intensity. You are literally holding their life in your hands. So it is stressful. And I think a lot of people in the room forget that. Sometimes I'll see something amazing. I'm going off on a tangent here. Sometimes I'll see something really amazing. I'll be like, do you guys believe what we're doing right now? This is incredible.
You mean just like the whole idea of it, like it's come to
like
you.
that sometimes I'll just like remind people in the room. I'll be like, do you guys realize what we're doing? Do you realize that we're literally stopping someone's heart and working on it and restarting it? Just reality check for just a second. But it's really stressful what we do. And so sometimes like the emotions fly high. And so you sort of have to go back, and a lot of people will just say, just leave it in the room or leave it on the field, like the football field, But for a woman, I think it's really important to go back, and I think it helps to go back and say, hey, I was really stressed out. I was worried for this patient. And remember that like all this is about the patient. And just say, it's helpful for me anyway to go back and say, I'm sorry about if there was anything I said that might have upset you. I was just worried about the patient. I was stressed out. I was nervous for what we were doing. Please don't take it personally. I think you're a great nurse or assistant or anesthesiologist or whatever.
So you probably don't see your colleagues because you're working separately, right? But do you think that a male colleague would be having that conversation afterwards?
No. Okay. I don't think so. I think I'm compensating. I'm overcompensating because I know that works for me.
Yeah. Well,
it sucks that you have to do that, but
yeah. No, I know that well. I do less of it now than I used to, but I certainly I know.
Well, I'm sure I'm going to be a curmudgeon-y old fart when I'm old, and I'm not going to care. But right now,
when are you going to be old? What age is that?
Like 70, maybe. I don't know.
Okay, so you got another 29 years.
Yeah, I think so many girls are discouraged from doing what I do because one, they don't see us in this field. They don't have female leaders. Sorry.
Well, but I mean, if you're a kid, you don't hopefully ever see a cardiac surgeon, right?
Yeah, but let's say you go to medical school. So my experience was I went to medical school. My mom was like, you're going to be a doctor. You have to be a doctor. So I go to medical school. The dog. I go to medical school. I'm exposed to all these things. I'm like, I know cardiac surgery. I like cardiac surgery. And everyone around me is like, you like surgery. Why don't you do ENT? Why don't you go and be an ear, nose, and throat surgeon? That's good for lifestyle. And so I was like, okay, fine. I'm going to do ENT. Let's do this. And I go and I start some research projects with the ENT at my medical school. And I'm like, I go into the OR and I'm like, this sucks. Like, this was horrible.
Too much snot? What didn't you like?
I just didn't like the procedures. So I was like, I went to the dean and I was like, I don't know what to do. I love heart surgery, but everyone I keep talking to says don't do it because it's long hours and you'll never have a life. But I really like it because I didn't have any female mentors to tell me that it was okay and you can do it. So like my whole thing now is to be present. So I go to the Bryn Mawr science fair. I'm present.
That's a private school here in Baltimore.
Yeah, sorry. I go to the private schools and I'm present. I'm present at my boys' school, so that all the young kids can see that there are women heart surgeons, and try to be like a mentor to them to say, this is totally doable.
So you said there are like 300 or 400 of you, and there's a big picture every year. What is that conference?
Oh, the Women in Thoracic Surgery.
Okay.
Yeah. So, and then also at the big society meeting, a lot of times there's like a night where the women get together, and so you can kind of mingle with your fellow people.
So are there any more like people younger than you in this? Do you see more people in their 30s or their I guess people aren't really cardiac surgeons in their 20s?
Yeah, and I think really ambitious girls will find me. They have. I have one girl who's followed me. I've seen her since high school, and so she's like, I think I like trauma surgery, but I also might like cardiac surgery. And I'm like, go girl, you go, you got this, you know. So yeah.
So how about the generations above you? Are there fewer women in like their 50s and their 60s doing cardiac surgery, and more in their 40s and more still in their 30s?
I think so. Yeah.
So what's the youngest you could be a cardiac surgeon?
35.
Oh wow. Okay.
Yeah.
Okay. So they're not in their 20s.
No, you're still in training. Like you lose your 20s to training. I auditioned for Phantom Regiment, and I got down, there were like 30 applicants, and so we all did our conducting piece. And I can't remember which piece I conducted, but the thing about the Phantom Regiment is it's classical conducting, so you use the baton, and it was fun. It was amazing. It was an amazing experience. And I got down to the top 4, which means you get to conduct in front of the whole group of all the auditionees. So everyone who's auditioning to be in the Phantom Regiment is also playing, and so you get to do like the piece that they've picked for you. So that was really cool, and it was an amazing experience, but of course, I didn't make it. I didn't make the cut.
So you think maybe conducting is like on the percentage of women in conducting might be like in cardiac surgery?
I think so. I think so too. I think so.
What else? And tuba, what else?
Tuba. So
maybe
my friend,
pilots?
that same moment, my friend and I, she was there too, which was totally incidental. I didn't know she was auditioning too, but she was auditioning for tuba. Talk about female trying to do tuba. And the thing about the tuba in the marching, the drum and bugle corps, you have to like lift this tuba up onto your shoulder, and she's this 5'1" girl. And they were worried that she couldn't do it fast enough to do like all the moves and stuff. So they were like, we really like you. We think she was really talented. So they actually switched her over to euphonium, and she auditioned and she made it. But it was kind of like,
maybe she could have totally lifted that
tuba was her thing. You know, tuba was totally her thing, and they were like,
she could totally lift a tuba.
Yeah, so it was a little bit of sucked for her.
When was the last time you played an oboe?
Probably in college.
So that was some years ago. That was like
2002.
20 years ago? Okay.
22 years ago.
But you have one in your house. Does it work? You don't know.
Oh yeah, it does work because my daughter found it.
The
other day when we were, I don't know why we were she got my flute out first. And I was like, let's get the oboe out too while we're just getting all the instruments out. Let's get it all out, because the only instrument I get out now is my violin. So
okay, well I think for the final part of the video, like we definitely need some oboe playing from you. Like your first
Oh my god.
your first time playing the oboe in 22 years
my gosh.
after like several drinks, right?
Oh yeah, sure. Why not?
Yeah, I think we totally gotta do that. And I gotta show you the bass oboe because it's so cool.
Yes.
It's
Yeah.
like the
Let's
coolest
do it.
thing ever.
Let's do it.
Played an oboe 22 years ago.
Yeah.
Okay, let's see how the bass oboe goes. You ready?
Are we playing? Are we live now?
You were live, totally live, all over the internet. Pretty good. That's awesome. That's really good.